Foot pain is very common. Most people experience some type of foot pain during their lifetime. Pain can occur anywhere in the foot, and the incidence of foot pain increases with age, and it often occurs as a result of daily activities and exercise. Here to talk about the types of foot pain, symptoms, and treatment is Dr. Mark Lambert with the Pensacola Foot and Ankle Center and a member of the medical staff of Sacred Heart Hospital. Thank you, Dr. Lambert. Appreciate you.
Thank you for having me, Lauren.
So what are the three main parts of the foot, and what are they most prone to?
The foot can be divided into several main parts, and it just depends on their functionality with the ambulation. The forefoot generally includes the toes and the metatarsals. The midfoot is more of what we consider to be the arch area, and the rear foot is the heel bone and the bone that leads up to the ankle, called the talus. And then, of course, there's the ankle that connects the foot to the leg. The problems that can occur in the foot are multifactorial, based upon injury, based upon chronic use, based upon the things that we do to live our everyday lives.
So what are some of the common risk factors and causes that people may see?
Well, I think in the aged population, we're seeing people that want to maintain an active lifestyle. Quite often we have 70 and 80, 90-year-olds that still expect to walk in the mall and go on trips and maintain a very active lifestyle. And sometimes their lower extremities are not quite adapt to living up to their expectations, so they need a little bit of help now and again.
What are specific causes determined and what is involved?
Some of the things that can help people maintain a healthy lifestyle in relation to their foot is just preventive maintenance, almost like taking care of an automobile or a complex machinery. People performing regular exams with the aid of a podiatrist, their family practitioners, regular maintenance of their feet, cleaning. Proper shoe gear is very, very important for people. Quite often the elderly will opt for less expensive shoes when in fact they really should use more complex shoes to help support their foot.
Well, that's some great advice. Are these conditions usually chronic or acute?
They can be a combination of both. Quite often you'll have an acute injury, someone trips and falls or stumbles, sprains their foot or their ankle, and it is an acute problem, but quite often it is a chronic condition that has gone on for quite a long time. They've limped along and put Band-Aids on there, but they haven't really addressed the root cause of the problem. And quite often a podiatrist or a foot specialist can help them produce a proper treatment plan to get them back on their feet and get the foot operating properly with the leg and the rest of their body.
Great. So can lifestyle modification help in this case?
Absolutely. It's not that we want them to cease activity, but maybe modify their activity a little bit. If they're walking on hard surfaces such as a track, we might have them using a less abusive surface, such as walking on the grass or on clay, on sand. If they're walking a large number of miles and it's causing stress problems, we might have them walking more frequently but smaller number of miles. If they're using a course that maybe has got too much incline or decline and it's causing problems, we might have them walk on more of a flat surface. Just modification of what they're already doing is a great help.
Okay. What type of treatment options are out there for this?
There are a lot of treatment options available for these problems that the elderly can have. We've got some new advent of shockwave therapy, similar to what they've been using for lithotripsy of kidney and liver problems. We're now using in the foot and ankle to alleviate certain conditions. We also have the use of a new stem cell product. It's called platelet-rich plasma, and a lot of times we can help with some of these chronic injuries using the patient's own stem cells, and that really has been a beneficial thing.
It seems like treatment has really evolved over the years. What would you say is the latest and greatest?
Treatment has just really taken off now. We can tailor the exercise directly to the patients using physical therapy. We have a wonderful relationship with the therapist. They can help us tailor plans to the patient using simple things such as cryotherapy, ice, all the way to high voltage stimulation, target stimulation, iontophoresis. There's just a multitude of high-tech treatments for these patients to help with these chronic and acute conditions.
Okay, well that's some good news. So can a patient become good as new again?
I think that we can maximize their potential, and that's really what's most important. A patient may not be able to get out and jog 100 miles a week like they did when they were younger, but we can sure help them maintain an active lifestyle, help them live up to their potential, and maybe reach some of the goals that they've set for themselves as far as maintaining the health when they get into later years.
Well, great. Well, what's the number one thing you'd like our viewers to take away from this about foot pain?
That foot pain is not normal. It's not necessary. It's not part of the aging process. Foot pain can always be addressed and treated conservatively. Sometimes there's a surgical option that is needed to get the patient relief of their symptoms. But they need to know that foot pain can never be just brushed under the rug and just considered part of their life. They can always address it and always find a solution to the problem.
Good. So how can our viewers get more information about this?
We have a wonderful group of podiatrists in Pensacola. My office is also very willing to help them. I have a website that they can go to get information, as well as calling the office at 477-9015. Our website is penfootank.com, penfootank.com. The other resources that are available is the American College of Foot and Ankle Services website. They can Google that. And the American Podiatric Medical Association website also has a lot of information available.
So lots of places people can get information.
They really can.
Well, we thank you for being on today, Dr. Lambert.
Thank you very much.